MPs have raised issues to help take preparations for the next pandemic forward. Now, this includes the local production of masks and the country's response to long COVID. 19 MPs spoke on the first day of the debate on the White Paper. And kicking it off, the Leader of the Opposition asks if the original after-action review on COVID-19 can also be made public.
Are the contents of this White Paper all the findings from the AAR that the government is prepared to share with the public and Parliament? Presumably, Mr. Peter Ho submitted a more comprehensive AAR report to the government.
Mr. Singh adds that the Workers' Party was mindful throughout the pandemic that unity of purpose was needed. The opposition party says that it advanced concrete suggestions and held the government to account. That's instead of riding on misinformation or misunderstandings of national policy to score political points.
The Workers' Party did not come in to publicly criticize the government on its handling of an unprecedented crisis. We were determined to support and not undermine the national effort. As a political party that is not in government, the Workers' Party will continue to lead with this approach in times of national crisis.
Well, MPs also spoke about the local supply of masks in the long term and urged the government to consider the impact of long COVID on its national healthcare strategy.
Why did Singapore not have sufficient domestic capacity to manufacture items as basic as face masks? Was the government not able to marshal local companies to accept and prioritize contracts for manufacture of materials deemed essential for our defense against COVID-19, including face masks and ventilators?
For the production to be viable, it will require some domestic anchor orders or offtake from the government so that there is a base level production volume to work with. Continue to encourage Singaporeans to adopt mask-wearing habit. This will not only create some local demand for masks, but also help reduce the spread of other airborne diseases such as flu, cold, cough, and other influenza.
The Ministry of Health stated in April last year that it did not track the incidences of long COVID. This is a missed opportunity, not only because it means many recovered patients, particularly those for whom these after effects may not be severe, may be suffering in silence, and it affects their productivity both at home and in the workplace. They also do not have access to the treatment and care that they need to have a better quality of life.
While some members also highlighted other areas where the country has done well.
A big plus that did not seem to be highlighted adequately in the White Paper is how we managed to effectively redeploy manpower to where it is needed. One example would be how around 3,000 safe distancing ambassadors and enforcement officers were deployed and coordinated by the Ministry of Sustainability and Environment (MSE) to ensure compliance with safe management measures and vaccinated differentiated SMMs in public spaces.
The business community is glad to see that we did not waste the crisis and that the government chose to professionally and honestly reflect and learn from the events and the actions taken, including the U-turns that had to be made along the way.